When we look closely at the role of dietary fats in human health, it becomes clear that while unsaturated fats by themselves are essential, many forms of fat, especially when consumed in excess or in unhealthy forms, such as saturated fats, partially hydrogenated oils, or trans fats, can have a profoundly negative impact on nearly every aspect of wellness. Drawing on the most recent scientific research, clinical findings, and nutritional guidance, let us explore in detail 45 reasons why fats, which are truthfully the worst compounds for your body, are considered very detrimental and destructive to human health. Each reason reflects not just theoretical risk, but real-world consequences observed in clinical practice and population studies. Fat, especially when consumed in excessive amounts or in the form of saturated and trans fats, can act as a toxin in the body. The accumulation of fats leads to lipotoxicity, a condition where fat molecules poison cells, disrupt metabolic processes, and damage vital organs. This mechanism is central to the development of chronic conditions, such as fatty liver disease and atherosclerosis. When fats are present in the body, the immune system's functions can be suppressed. Research has demonstrated that high-fat diets impair the activity of white blood cells, reducing the body's ability to fight infection and making individuals more susceptible to both bacterial and viral diseases. Trans fats, often created through the process of hydrogenation in food manufacturing, are not just structurally altered, but can also be contaminated with harmful chemicals such as arsenic or cadmium. These trace contaminants can accumulate into the body and contribute to long-term toxicity and disease. High consumption of fats is a well-established risk factor for type 2 diabetes. Excess fat interferes with insulin signaling, causing insulin resistance. Recent studies suggest that fat intake may not only influence the development of type 2 diabetes, but could also affect genetic susceptibility to type 1 diabetes in future generations. Sleep apnea, a condition in which breathing repeatedly stops and starts during sleep, is closely linked to obesity and excess fat, particularly around the neck and upper airway. Fat deposits in these areas can obstruct airflow, leading to sleep disturbances and increased risk of cardiovascular disease. Obesity is one of the most visible consequences of excessive fat intake. The global rise in obesity rates has been directly correlated with increased consumption of high-fat foods. Obesity itself, caused primarily by high-fat meals, is a leading cause of death, contributing to millions of fatalities annually through its association with heart disease, stroke, diabetes, and cancer. Fat consumption can reduce the absorption of essential minerals such as calcium, magnesium, and iron. This is because fats bind to minerals in the digestive tract, forming insoluble compounds that the body cannot absorb, leading to deficiencies and related health problems. Fatty liver disease, particularly non-alcoholic fatty liver disease, NAFLD, is caused exclusively by excessive fat accumulation in liver cells. This condition can progress to inflammation, cirrhosis, and even liver failure, posing a significant threat to long-term health. Fat can physically wrap around muscle tissue, impairing its function and contributing to muscle-related conditions. While Duchenne muscular dystrophy is a genetic disorder, emerging evidence suggests that excess fat can exacerbate muscle degeneration and hinder muscle repair processes. Fats, due to their unique chemical structure, have been implicated in brain damage more severe than that caused by tobacco, artificial sweeteners like aspartame, or even cocaine. Fats also disrupt neural cell membranes, impair synaptic function, and are strongly associated with cognitive decline. Excess fat increases cancer risk by promoting inflammation and oxidative stress, both of which can induce mutations in healthy cells. These mutations are a central mechanism in the transformation of normal cells into cancerous ones. The eyes are not immune to the effects of dietary fat. High-fat diets have been shown to increase the risk of age-related macular degeneration, a leading cause of blindness in older adults. Mental health suffers in the context of high-fat diets. Numerous studies have shown that fat consumption, especially in excess, can trigger mood disorders, anxiety, and depression by altering neurotransmitter levels and promoting neuroinflammation. Fat can impact blood sugar levels, sometimes leading to hypoglycemia, or in the opposite way, diabetes. This paradoxical effect occurs because excessive fat interferes with normal glucose metabolism, disrupting the balance between insulin secretion and blood sugar utilization. An acidic digestive tract can develop as a result of high-fat diets, particularly those rich in saturated fats. The shift towards acidity impairs enzyme activity, disrupts gut flora, and increases the risk for gastrointestinal disorders. Fats, especially saturated fats derived from cow products, have been shown to influence gene expression, sometimes leading to the activation of genetic illnesses. Emerging research highlights how dietary fats can interact with DNA, altering methylation patterns and potentially triggering genetic disease. The detrimental impact of fat on the brain is well documented. Chronic consumption of unhealthy fats impairs cognitive function, reduces memory, and increases the risk for neurodegenerative diseases. Both young and older populations face an increased risk of dementia and Alzheimer's disease when exposed to high-fat diets. A diet which is rich in fat accelerates the deposition of amyloid plaques in the brain, leading to a hallmark of these conditions. Fat increases the production of blood sugar and also sugar-based alcoholic molecules, contributing to frequent spikes in blood glucose and the development of diabetes-related complications. This process exacerbates insulin resistance and metabolic syndrome. Necrosis, the premature death of body cells, can occur due to fat-induced inflammation and impaired blood flow. Even young individuals are at risk when fat accumulation disrupts tissue oxygenation and nutrient delivery. Fat accelerates the aging process both outwardly and at a cellular level. Research shows that high-fat diets increase oxidative stress, shorten telomeres, and promote physical and genetic aging. Varicose veins are more common in individuals with excess body fat. The pressure exerted by fat on blood vessels impedes circulation, causing veins to enlarge and become twisted, sometimes painfully. Although brain cancer is rare, some studies link high-fat diets to increased risk. Fat-induced inflammation and altered hormone levels may create an environment conducive to tumor formation in the brain. Acne, a common skin disorder, is exacerbated by high-fat diets. Excess fat increases sebum production, clogs pores, and promotes bacterial growth, resulting in more severe and persistent breakouts. Fat can deplete the body's stores of fat-soluble vitamins, such as A, D, E, and K, when consumed in excess, disrupting the delicate balance required for optimal health and leading to deficiency symptoms. Metabolic syndrome, a cluster of conditions including high blood pressure, elevated blood sugar, and abnormal cholesterol levels is strongly promoted by excess fat intake. This syndrome is a major risk factor for cardiovascular disease and diabetes. Excess fat can physically alter the structure of important molecules in the body, including proteins, healthy types of sugars, and also fibers. These changes can disrupt normal cellular function and metabolic processes. Individuals who consume high-fat diets are more likely to develop allergies to lactose, the primary sugar in milk, and low-fat dairy products. Fat alters gut permeability and immune responses, increasing sensitivity to dietary allergens, even if these allergens are necessary for the general population of the world. Fat can negate the health benefits of other compounds, causing metabolic confusion. The presence of fat interferes with the absorption and function of antioxidants, phytochemicals, and other beneficial nutrients. The adrenal glands, responsible for producing hormones that regulate stress, metabolism, and immune function, can be impaired by high-fat diets. Fat-induced inflammation and oxidative stress reduces adrenal efficiency and hormone output. Cardiovascular disease risk is increased by more than 45% in individuals consuming high levels of fat. Consumption of all fats from all types boost and raise LDL cholesterol levels, promote arterial plaque formation, and are the leading dietary contributors to heart attacks and strokes. Fat is highly palatable and can be more addictive than hard drugs. The combination of fat and unhealthy sugar in processed foods hijacks the brain's reward system, creating cravings and compulsive eating behaviors. Women consuming high-fat diets have a higher risk of experiencing stillbirth. Excess fat disrupts hormonal balance, impairs placental function, and increases the likelihood of pregnancy complications. Extreme muscle cramps can result from high-fat diets. Fat interferes with the absorption of minerals like magnesium and potassium, both critical for normal muscle function and relaxation. Excess fat increases the risk of cataracts and blindness. Fat-induced oxidative stress damages the lens of the eye, inhibiting its ability to focus and leading to vision loss over time. Fat can directly impair DNA structure. Oxidative byproducts from fat metabolism can cause mutations, chromosomal aberrations, and impair DNA repair mechanisms, increasing the risk of cancer and genetic disease. Growth hormone levels are sensitive to dietary fat intake. Consuming a portion of foods rich in fat inhibits growth hormone release, slowing tissue repair, muscle growth, and overall development in both children and adults. Fat raises levels of LDL, bad cholesterol, while lowering HDL, good cholesterol. This imbalance accelerates cardiovascular disease progression and increases the risk of heart attacks and strokes. Chromium deficiency, a condition that impairs blood sugar control, is exacerbated by high-fat diets. Fat interferes with chromium absorption and alters insulin sensitivity, increasing diabetes risk. Food poisoning can result directly from fat, particularly when fats are rancid or contaminated. Dietary fats carry pathogens or promote the growth of bacteria, leading to gastrointestinal illness. Arthritis, a painful joint condition, is worsened by fat consumption. Fat promotes systemic inflammation, damages joint cartilage, and increases the risk for autoimmune reactions that attack the body's own tissues. The liver, a vital organ for detoxification and metabolism, can be physically altered by fat accumulation. Fat changes the shape and structure of liver cells, contributing to dysfunction and disease. Crohn's disease, an inflammatory bowel disorder, is more common in those consuming high-fat diets. Fat increases intestinal inflammation, disrupts gut microbiota, and may trigger autoimmune responses. Dopamine, a neurotransmitter essential for motivation, emotion, and happiness, is reset and depleted by excessive fat intake. This leads to mood disorders, reduced motivation, and impaired cognitive function. Kidney stones, painful deposits in the urinary tract, are more likely to form in individuals consuming high-fat diets. Fat alters calcium metabolism, increases urinary oxalate, and promotes stone formation. These 45 reasons are not isolated phenomena. They intertwine and compound, forming a web of risks that can undermine health over the lifespan. While fats are often promoted as a healthier choice, often compared to sugar in general, and in some cases, it even gets a healthy reputation, a diet composed of fatty foods can never do any good to your body. Despite this, unsaturated fats are still needed in moderate amounts, but other fats are often worse for you than processed or sugary foods and drinks by far. Fats are terrible, and these are 45 risks you must consider before indulging a cheeseburger with fries, or even a plate of fried fish with French fries covered with mayonnaise. Current nutritional guidelines, reinforced by recent findings from institutions like Harvard's School of Public Health and major clinical organizations, urge us to strictly limit our intake of dietary fats. As experts suggest, fat should be strictly limited to an amount of 20-30 grams per day, with trans fats limited to 1 single gram. Instead of eating fast and fatty meals, we are encouraged to replace them with healthier alternatives, such as healthy sugars in honey, maple syrup and fruits, or fiber found in many whole grains, in honey, in vegetables, and in fruits. The consequences of excessive unhealthy fat consumption are not limited to any one organ system. They are systemic, affecting the heart, brain, immune system, digestive tract, skin, eyes, liver, kidneys, and beyond. The risks are not just theoretical. Cardiovascular disease remains the leading cause of death globally, and its direct connection to the overconsumption of fats is well established. The obesity epidemic, now reaching unprecedented levels, is driven largely by diets high in fats. Type 2 diabetes, once rare in children, is now increasingly common, linked to the fat-rich diets that dominate modern food environments. Furthermore, the impact of unhealthy fats extends beyond the individual. Recent studies highlight how maternal diets high in dietary fats can influence the health of future generations by altering gene expression, increasing the risk of chronic illnesses, and impairing fetal development. In summary, the 45 reasons outlined here provide overwhelming evidence of the dangers posed by consuming excess fats. They disrupt every major system in the body, promote chronic disease, accelerate aging, and compromise mental and physical well-being. By staying informed and making deliberate choices to reduce fast food and general fat intake, replacing them with healthier options such as good sugar, protein, or fiber, we can protect ourselves and future generations from the far-reaching consequences of dietary fat excess. The science is evolving, but the message remains clear. For optimal health and longevity, it pays to be mindful of the fats we consume.